Welcome to this brief presentation on how Tysabri, natalizumab, may work to help patients with relapsing forms of multiple sclerosis, or MS. Tysabri is a prescription medicine approved for patients with relapsing forms of MS to slow the worsening of disability that is common in patients with MS, decrease the number of flare-ups, relapses. Tysabri does not cure MS and has not been studied for longer than 2 years or in patients with chronic progressive MS. Because of the chance of PML, Tysabri is generally recommended for patients that have not been helped enough by or cannot tolerate another treatment for MS. Please see important safety information at the end of this video. MS is an autoimmune disease that affects the central nervous system. The immune system normally defends the body against foreign invaders, such as viruses or bacteria. In an autoimmune disease, the immune system instead attacks the body. In patients with MS, white blood cells, an important part of the immune system, move from the blood circulation into the central nervous system, which includes the brain and spinal cord. That's called crossing the blood-brain barrier. Once in the brain, these white blood cells can attack nerve cells, stripping away the layer of insulation known as the myelin sheath. The myelin sheath protects the nerve cells and helps electrical impulses travel to and from the brain. Damage to the myelin sheath causes lesions that may lead to scarring. Severe damage and scarring can keep brain cells from functioning properly and cause the symptoms of MS. Let's take a look inside the circulation and brain to see how this happens. Alpha-4 integrins are molecules found on most white blood cells. They are shown here as bumps on the surface of the white blood cell. One of the jobs of alpha-4 integrins is to help white blood cells bind to other cells. That binding process is key to the way that white blood cells defend the body against viruses and bacteria. But binding also helps white blood cells cross the blood-brain barrier. Here's how that works. Before a white blood cell can cross the blood-brain barrier, it first must bind to the wall of its blood vessel. To do that, the alpha-4 integrins grab onto special molecules on the vessel wall. These molecules, shown here as green shapes, are called VCAM1s. VCAM is short for vascular cell adhesion molecule. After the alpha-4 integrins bind to the VCAM1 molecules, the white blood cell begins to roll along the blood vessel wall and gradually slows to a stop. Once it stops, it is drawn through the wall into the brain, where it can cause the nerve damage that leads to MS. Tysabri works differently than other MS medicines. It is not an interferon or a glutarimer acetate. It targets alpha-4 integrins. Although Tysabri's exact method of action is not fully understood, one of the ways that it may work against MS is by blocking the binding of alpha-4 integrins to VCAM1s. That effectively prevents white blood cells from crossing the blood-brain barrier. Tysabri may also have additional effects within the brain and central nervous system, helping to block other processes that increase inflammation and lead to nerve damage. Based on these possible mechanisms of action, studies have shown that Tysabri works to reduce relapses and worsening of disability and is an important treatment option for people with relapsing forms of MS. Important safety information. Tysabri increases your chance of getting a rare brain infection that usually causes death or severe disability. This infection is called progressive multifocal leukoencephalopathy, PML. PML usually happens in people with weakened immune systems. No one can predict who will get PML. Your chances may be higher if you are also being treated with medicines that weaken your immune system, including other MS treatments. If you use Tysabri alone to treat your MS, you can still get PML. It is not known if the length of time on treatment with Tysabri increases your chance of getting PML. There is no known treatment, prevention, or cure for PML. If you take Tysabri, it is important to call your doctor right away if you have any new or worsening medical problems, such as a new or sudden change in your thinking, eyesight, balance, or strength, or other problems that have lasted over several days. Tell all of your doctors that you are getting treatment with Tysabri. Because of the chance for PML, Tysabri is generally recommended for patients that have not been helped enough by or cannot tolerate another treatment for MS. Tysabri is available only through the Touch Prescribing Program, which is a restricted distribution program. Only prescribers, patients, and infusion centers enrolled in the Touch Prescribing Program can prescribe, receive, and infuse Tysabri. Before you take Tysabri, you and your doctor must enroll in the Touch Prescribing Program and agree to the program requirements. Plan to see your doctor 3 months after the first infusion, 6 months after the first infusion, and at least as frequently as 6 months thereafter. Tysabri does not cure MS and has not been studied longer than 2 years or in patients with chronic progressive MS. Tysabri is not approved for use in patients under age 18. You should not receive Tysabri if you have PML or are allergic to Tysabri or any of its ingredients. Tysabri is not recommended if you have a medical condition that can weaken your immune system, such as HIV infection or AIDS, leukemia or lymphoma, organ transplant or others, or if you are taking medicines that weaken your immune system. Talk with your doctor about all of the medicines you take or have taken. Tysabri may increase your chance of getting an unusual or serious infection. You should not take Tysabri if you are pregnant, trying to become pregnant, or nursing. Tysabri may cause liver damage. Symptoms of liver damage can include yellowing of the skin and eyes, jaundice, unusual darkening of the urine, nausea, feeling tired or weak, or vomiting. Blood tests can be done to check for liver damage. Call your doctor right away if you experience any symptoms of liver damage. Other serious side effects with Tysabri include allergic reactions, e.g. hives, itching, trouble breathing, chest pain, dizziness, wheezing, chills, rash, nausea, flushing of skin, low blood pressure, including serious allergic reactions, e.g. anaphylaxis and infections. Serious allergic reactions usually happen within 2 hours of the start of the infusion, but can happen any time after receiving Tysabri. Tell your doctor or nurse right away if you have any symptom of an allergic reaction. You may need treatment if you are having an allergic reaction. Tysabri may increase your chance of getting an unusual or serious infection because it can affect your immune system. Common side effects include headache, urinary tract infection, lung infection, pain in your arms and legs, vaginitis, stomach area pain, feeling tired, joint pain, depression, diarrhea, and rash. Tell your doctor about any side effect that bothers you or does not go away. Please see full prescribing information, including boxed warning and patient medication guide.